This study was focused on patients with diffuse large B-cell lymphoma who, after completion of initial therapy, such as R-CHOP chemotherapy, achieve a PET-negative complete remission. And we know that many of these patients are eventually cured of diffuse large B-cell lymphoma, but some patients can have recurrent disease. And so we typically follow patients after completion of chemoimmunotherapy to try to see if we can detect their recurrent disease at an earlier time point. And the idea behind this is really that if we can detect recurrence at the earliest time point, then we may be able to intervene earlier and patients may have better outcomes in the relapsed or refractory setting. So the purpose of this study was really to see whether we could use an MRD assay, the adaptive clonoSEQ assay, to detect circulating tumor DNA in advance of overt clinical relapse. And there has been data that's been previously published that suggests that we may be able to detect molecular relapse before a patient has an overt clinical relapse or before we can detect their disease radiographically. However, our study was the largest prospective multi-center study in which we looked at close to 400 patients across 5 academic centers to assess the role of MRD assessment during surveillance in large cell lymphoma. For these 400 patients who were enrolled in this MRD study, who were followed for 2 years after treatment, they all followed a standard surveillance schedule. So we saw patients every 3 months, and patients underwent CT surveillance imaging every 6 months. And at every time point, they had peripheral blood collected that was subsequently sent to Adaptive Biotechnologies for assessment using the clonoSEQ assay. And what we found in this study was that, unfortunately, the MRD assay was associated with a low sensitivity for detecting molecular relapse in the surveillance setting in large cell lymphoma. And interestingly, we also found that there was lower than predicted specificity associated with the test, meaning that we did find false positive results. So the MRD test could be positive even in patients who were in ongoing remission. So I think in conclusion, one of the interesting findings in the study was that although circulating tumor DNA is an important biomarker in diffuse large B-cell lymphoma and has been studied in various settings and been shown to be prognostic, in the context of surveillance for large cell lymphoma, I think the jury is still out about how to apply this technology. We're doing additional analyses to try to better understand the reason for the lower than expected sensitivity and specificity associated with the assay. And there may be a variety of factors that could influence these results, but I think we need further data to completely understand this in the context of MRD assessment in diffuse large B-cell lymphoma. But one of the interesting things that we found as a result of doing this standard surveillance with CT imaging every 6 months was that actually there were many asymptomatic relapses, meaning a patient was feeling completely well, they came into clinic, no symptoms, their exam was normal, their labs were normal, but their CT scan revealed that their large cell lymphoma was recurring. And asymptomatic relapses detected radiographically based on prior retrospective analyses have been reported to have a very low incidence. But in our study, we found 44% of relapses were actually detected using surveillance imaging in an otherwise asymptomatic patient. And I think this is a very important result. It really supports the use of CT surveillance imaging in large cell lymphoma, particularly for the patients who are at highest risk, such as patients who have advanced stage disease or high-risk IPI.